Diving with Implants by Dr. Laurens de Kock, performed by Dr. Frans Cronier. Yes, this one is for the ladies. Read on as Dr. de Kock busts the breast implant myths and pops the questions related to considerations when it comes to diving. Some of the most pressing questions on the lips of post-operative breast implant patients are: do I need to be concerned about taking special precautions with my new implants when I participate in any vigorous activities, for example scuba and skydiving? Will I experience any lethal or debilitating complications as a result of increased pressure in the underwater environment? Do I need to be more worried about bends? Will my implants implode or explode? Fortunately, the simple answer to all of these questions is no. Modern breast implants can withstand vigorous physical conditions, even the physical impact of increased water pressure during a dive. There is, however, a need for significant precaution involved in the timing and circumstances of returning to diving after breast augmentation or reconstruction, specifically during the recovery. And that's what we will consider first. The consideration for an all-clear to dive for patients who undergo breast augmentation or reconstruction does not differ much from the reasoning involved when considering other medical aspects such as conditions or medication use. In general, there are three questions to consider. Firstly, what is the underlying reason for the procedure? Is there an underlying or primary condition that may be a concern? As such, one needs to get information about the disease or condition, as well as the symptoms and how they affect the individual, the environment, and other people. Secondly, does the prosthesis or therapy itself have restrictions or precluding conditions on diving? Side effects, unwanted interactions with the environment, other diving factors, and systemic effects may all influence these decisions. And lastly, do the answers to any of the previous questions have an effect on diving safety or other individuals in the diving community? Breast implants require differing techniques, and they vary according to the implant, the result, body shape, and the tissue quantity and quality of the patient. The technique and individual preferences also vary according to surgeon and patient. The technical aspects and details go beyond the scope of this article. However, the surgeon will use all of this information to guide the patient in terms of the expected time to full recovery. Generally speaking, 6 to 12 weeks should be allowed, or up to 6 months in selected cases. The maximum wait time is recommended as the earliest time to resume diving. Inherently vigorous actions involved with pre- and post-dive activities demand that all the tissues should be properly healed following the surgical intervention. In terms of medical advice, the reconstructive surgeon holds the primary ticket to return to diving. Some patients receive breast implants following mastectomy for breast cancer. In the later stages of cancer, other organs may be affected, but if only the local tissues are involved and there are no considerations related to chemotherapy, there is no reason why diving should not be resumed after examination by a diving practitioner and the expertise of the treating surgeon, oncologist, and general counselor has been considered. Typically, breast implants are only considered once full remission has been confirmed. Post-surgical considerations. Does water pressure affect breast implants? Well, doctors at the hyperbaric unit of Duke University exposed different prostheses to dry dives in a recompression chamber. There were mainly two types: saline, which is essentially a plastic bag, and silicone gel. A third type combines the two. In these studies, the researchers did find that the prostheses absorbed nitrogen and produced bubbles on decompression. There was an average increase of about 4% of the volume of the prosthesis. Silicone was more prone to this effect than saline. However, the exposure was direct. In other words, the prostheses were exposed directly to the compressed gas. This is not the case when they are implanted. Apart from the volume changes being modest, the exposures that the breast implants were subjected to were all to direct gas, which is not the case when implanted in a human individual. One thing is for certain: they won't explode as a result of bubble formation, even in worst-case scenarios. Do breast implants increase the risk of decompression illness? No, there's no reason to think that they will, and there's no evidence that they have. Again, the results of the experiments at Duke University underline the statements as far as the prostheses themselves are concerned. If, however, there are surgical difficulties or other complicating factors, these would be the determinants and not the implants. Will implants change my buoyancy? Yes, silicone is negatively buoyant in comparison to saline, which is neutrally buoyant. This suggests that people with silicone implants will need to adjust their buoyancy. In addition to buoyancy considerations, though, the increased size of the upper body and the potential external confinement related to wetsuits and other dive gear should also be considered. A wetsuit may need to be resized, shoulder straps may need to be checked and adjusted. In conclusion, though, divers can rest assured that there are no reported significant risks from diving with breast implants.